I'm Cynthia Potyan, and I was diagnosed with multiple myeloma at age 64, right after my birthday.
I am Sister Elizabeth. I was diagnosed at the age of 52.
I am Milagros Cham Nava. I have been diagnosed with multiple myeloma at the age of 64, which was 2.5 years ago.
My dad, Semito, was diagnosed with multiple myeloma in 2005. Almost 20 years after, there is still no policy to provide access to the diagnosis and treatment of multiple myeloma patients. It's about time to provide access to patients diagnosed with multiple myeloma.
Multiple myeloma is a blood cancer characterized by the proliferation of abnormal plasma cells. And this will cause end organ damage like renal failure and fractures of the bones.
Multiple myeloma causes a host of symptoms including anemia, bone pain, infections, and hypercalcemia and kidney damage.
Blood diseases include blood cancers and bleeding disorders, and these are considered rare diseases, and therefore they have become neglected diseases.
Hi, I'm Karen Alparce Villanueva, and I'm the founder of MyeSPEAK, the Myeloma Support for Patient Empowerment, Access, and Knowledge. The vision of MyeSPEAK is to be able to create a sustainable network of partners so that patients suffering from multiple myeloma may have access to preventive, diagnosis, treatment, and even palliative care.
I am full support of MyeSPEAK because in the treatment of blood cancer, or any cancer for that matter, the cooperation of patient and their family is vital. And MyeSPEAK can help in this light because they are not only a support group, but they also advocate for patient education and access to medications.
I support MyeSPEAK because of the different advocacies that the group will push, and because in my experience as a hematologist, the success of the treatment of the patient lies not only with the technology and the accessibility of the drugs, but also with appropriate family and friend support.
Support groups fulfill many functions: educating patients and their families, sharing the illness experience, providing strength to its members, and raising public awareness, but maybe even including fundraising activities.
The biggest challenge in dealing with multiple myeloma is how to stay alive with quality of life. It is associated with a lot of physical pain, emotional challenges, mental, and of course, financial burden. Dealing with uncertainty in itself is a huge challenge.
Multiple myeloma imposed so many challenges in my life. It was my biggest challenge. And I was affected emotionally, physically, mentally, and financially. Physically, the pain was unbearable, most especially during the early days of the chemotherapy. I couldn't do things by myself. My body was so weak. My eyes were blurry. My mind was foggy. I depended on the strength of somebody else, like my children, so that I can function. And I was like an invalid. I couldn't even stand up from the bed. So that was really different from my lifestyle before because I'm very independent.
The challenge did not start only with dealing, no? It started with how it is to be diagnosed. It was so difficult to be diagnosed. It took time. I was feeling different things, but I had no opportunity to be diagnosed. It was thought of as only as an ordinary anemia. And then when I was diagnosed, there was no other person to whom I can have a second opinion.
Currently, there's very little awareness about multiple myeloma, and so MyeSPEAK endeavors to help the patient navigate their journey. there is a need to create awareness so that patients can have access to diagnosis, treatment, and even palliative care. Under universal health care, no patient should be left behind.
MyeSPEAK actively engages in advocacy and policy-making efforts, bringing together stakeholders to create impactful changes in healthcare policies. The organization leads projects to raise awareness, educate patients, and connect them with essential resources and support. From hosting workshops and educational campaigns to developing support programs, MyeSPEAK continues to provide essential information and assistance to those affected by multiple myeloma. This journey is supported by Takeda, whose commitment to advancing healthcare aligns with our mission to empower patients and improve their quality of life. MyeSPEAK, empowering patients, advocating for rights, and fostering a community where every voice is heard. Together, we champion a future of accessible and compassionate care for all.
Join us in raising awareness about this disease so that we can help multiple myeloma patients access the resources they need.